First, we're going to start with there's a couple of different types and causes of spondylolisthesis, which we have a list of. We're going to really focus on the first two, doctor, if that's okay, but I do want to just chime in on all of them.
Of course.
The first one is degenerative. Obviously, that's age-related.
Definitely. So if a disc degenerates, which happens in all of us, sometimes, so imagine, again, if a vertebrae sort of come closer together and they settle normally, then that's what happens to most people. But looking from the side, if the disc degenerates and the vertebra kind of shifts forwards, you develop what's called degenerative spondylolisthesis.
All right, the second one there is developmental with young athletes.
Definitely. So that's the one where kids will have a failure of formation of one little bony bridge.
So they're born like that.
Well, essentially, yeah. A bony bridge fails to form, and it allows a certain discontinuity between the joints in the back of each vertebra that keep the spine in its perfect upright posture. It disconnects those bones from the front of the spine, and that once again allows the spine to shift.
And those are the two that we're going to focus on this hour, but let's just briefly go through traumatic, tumor, and post-surgical.
So traumatic, meaning that that same bony bridge that's missing in kids can be fractured, and traumatic, actually, I see more and more now as my competitive athletes, especially guys that do baseball, golf, rotational type sports, they develop a stress fracture of that same bony bridge. A tumor at that region can also occur, and once again, it can disconnect the back from the front of the spine, allowing a shift, but that's rare.
And post-surgical, obviously that's after surgery. How does that happen?
So I've seen that as well.
Really?
Definitely, especially with younger surgeons that are doing minimally invasive technique where they don't feel comfortable with the anatomy. They will do a discectomy or a decompression type surgery where you have to remove a little bit of bone, but they won't see the entire bridge of bone. They just keep taking until they destabilize the spine. So essentially going at that same bony bridge that's missing in kids or broken as a stress fracture in athletes, sometimes that can be sort of taken away by a bad operation, once again resulting in instability.